Well, welcome everyone. My name is Anthony Mingo Sr. I have the privilege to serve here at the Fairfax County Health Department as the unit manager for community outreach and engagement. And I'm also an engaged and blessed father and grandfather. So I'm excited about this conversation that we're going to have today. Just a little bit about my background. I've been working in what we call stabilizing families field and working with parents, both fathers and mothers, for at least 15 years, and so I'm honored to be able to have this conversation. Um, Prior to coming here to the health department, I worked with VDH on a motherhood and fatherhood initiative that was a statewide initiative. So again, I'm excited to have this conversation. So as we set up our conversation today, yeah, our main focus is fatherhood and how fathers have an opportunity to foster generational health. Um, we know that in the space of fatherhood that it varies from fathering, and fatherhood varies from person to person, from culture to culture, and beyond. In this series, we're going to attempt to focus on a fatherhood experience as it pertains to what fathers can do and many would say should do to foster generational health and health habits that will benefit from a place of inheritance for the generations that come behind after them and to follow on. Um, what we hope to do is make this conversation impactful in such a way that we can have on ongoing conversations with dads from many cultures from around the county about what their fatherhood experience is in their culture, and in steps and in enhancing or the steps that they can take with their individual fathering and fatherhood experiences to foster generational health. So let's get started. As you know, June is a recognized month that we celebrate fatherhood. We celebrate fathers in June. But let me just say that fathering is an everyday experience. It's just we're thankful that we get recognized in the month of June, but it really is an everyday experience. So today, what we're going to is talk about the importance of fathers and their roles in generational health building, um, and its inheritances, and we should seek that we seek for our children and our grandchildren. For those of us like myself, I'm an older father that now has transitioned to being a grandfather. Sometimes you think that fathers think that their legacy or significance is in how much money that they make, but really what we're talking about in this show is the importance of how health can and the activities that we as fathers do around health can transcend generations and therefore really improve health generationally, not only in our families but in our families. Um, the other thing what we're going to talk about is the four pillars of health: our physical health, our emotional health, our mental and spiritual health. As fathers, we having an understanding of how these pillars transcend generations, like I mentioned earlier, is going to be fundamentally important. And then finally, what we're going to do, ladies and gentlemen, is to discuss some tools, some takeaways that fathers can put in their health toolbox um, to help them build health generationally as we go forward. So let me at this time introduce our esteemed guests. I work alongside this man every day, and he's just a wonderful example of dad, a wonderful example of a servant to our communities, and a wonderful employee here at the Fairfax County Health Department. So I wanted to introduce you to Shafiq Qureshi, and who's a member of our outreach and engagement team here at the health department. And Shafiq, Please, if you could tell us a little bit about yourself, I'd appreciate that very much. Thank you.
Thank you very much, Mr. Mingo, for having me on this Facebook Live. As you mentioned that I work for the Fairfax County Health Department as a community health specialist. I conduct public health outreach in the Muslim community to strengthen the capacity of our community for healthy life. My work include initiatives to help community members maintain and improve their health, prevent the spread of infectious diseases, management of chronic diseases, and emergency preparedness. And I'm dedicated to my public health work. As the discussion is on a fatherhood experience, I would like to also share that I am a father of 7 children, ages from 19 years old to 6, and I have only one daughter who is 7 years old. I am a Muslim Afghan American dad and proud to be father of 7 children. My children are everything for me, and I live for them, and I do my best to raise them healthy children of the society. Thanks.
Yeah, thank you, Shafiq. And
You're welcome.
I know that you're soon to be a dad of eight.
Yes.
So
Thank you
congratulations
so much. Yeah.
from me, and we're excited here at the health department
Thank you.
about that as well.
Yeah.
As you heard me mention earlier, there are four pillars of health. Um, Emotional health, our mental health, our physical health, and our spiritual health. Let's move forward and kind of unpack, if we can, as dads, as fellow dads. We're just having a conversation here on what these four pillars mean to you. So let's get started. Perhaps with let's talk about spiritual health and what does this mean to you?
Thank you. It's a very great question. As we know that beside our physical being, such as our body, shape, and look, as a human being, we have a spiritual component to our existence. A spiritual health signifies being spiritually or internally sound, upright, in good shape. Our physical well-being depends on physical materials such as food, exercise, healthcare. For example, if in order to our body function well, we need to eat. We need to eat food, and also to be physically fit we need to do exercise. If we get sick, we need to get medication, and also it depends on any other tangible elements. However, our spiritual health depends on things beyond the material and physical items. Faith and belief system play a major role in our spiritual health. As our bodies need food, our soul and spiritual being also need food. However, the food for our soul does not come from this material world. Living a purposeful life, believing in a metaphysical world, in a creator who had laid out the path forward for life and for afterlife, provide food for the soul and improves and sustain our spiritual health. As a Muslim, my faith is the main source of guidance, inspiration for a good, productive, and purposeful fatherhood. My faith gives me the energy, the insight, and the joy to be a good father. It also instructs me the moral obligation, responsibilities to raise spiritually sound and productive children. And also, fatherhood to me is not a burden, and it's the opportunity, or it's the it's experience that has challenge, that includes challenges and hardship on one hand, and joy and sense of achievement on the other hand. And also, I try to instill these spiritual life booster into my children so they can grow up spiritually sound and strong individual to become productive and contributing members of the society. I keep them connected to the worship and worshiping God and to work and places of worship. And I can give the example that how I keep my children spiritually healthy. Every weekend, Saturday and Sunday, I take my children and I drive 1 hour, almost like 40 miles. I take them to the mosque they would like to go and learn about their faith and about their religion in order to connect them with their faith and to be spiritually healthy. So those are some of the things that I believe about, and I would like to share about the spiritual health. Thank you.
Yeah, thank you so much, Shafiq, and
You're welcome. Yeah.
that's awesome. And I love the fact that you operate from a lens of fatherhood, that you see things that others might see as barriers or challenges. You see them as through a lens of opportunities.
Yes.
And I appreciate that wisdom that you just shared. Um, Also, you know, I know that you're originally from Afghanistan, and
Mhm.
um, I was just curious if you could share if there are any nuanced differences between fathering experience here in America and also in your home country of Afghanistan. Is there anything that you can share so folks can get further insight into your wonderful country as well?
I can say that the parenthood responsibilities of the parenthood may similar in every culture. Some of the things can be different. I can say, like for example, the environmental and socio-economic conditions that influence our approaches may vary. Every society has its own challenges and opportunities. In Afghanistan, parents face financial and security and educational challenges in their parenthood. But in the United States, it's more of modern lifestyle, easy access to technology, more autonomy for children to be expressive and more outspoken. For example, in Afghanistan, children they do not have opportunity to have so many questions from their parents to express their feelings, but here in the United States, there's a good thing that they have, if they have they would like to clarify something, they ask question from parents. So there's good and bad in every culture. So some things might be very good here in the United States, but some of the behavior and principle in Afghanistan might be different. The other thing
Wonderful.
in Afghanistan, the parenthoods are another more easy because there's a family oriented and people live all together in maybe 2 3 generations, so you have much support from your uncles, aunt, and in your grandparents. While here in the United States, everybody had a busy life, and it's
Yeah.
hard to have some family support while you are away from home, so someone can take care of your children. But in Afghanistan, you have more family support.
Yeah. Thank you so much. And yeah, I think it's important for all of us that are fathers to understand that um, that you know that we don't have to do it alone, right? Like
Yes.
we as fathers sometimes think that we have to do things alone, and it is important to seek advice and wisdom and help from other family members. So thank you for bringing that forward.
Mm.
Also, just a couple other things as we're walking through these pillars of health. I know that we talked about you know, mental health. And, you know, could you kind of give me a sense of how you model positive mental health in your family?
Sure, yes. Mental health is a very critical issue for individuals, for families, for communities, and for society at large. As a family, we take mental health seriously and we do everything we can do to stay mentally healthy at home. And also, talking about mental health is not a taboo in our family. And this is very
Thank you.
good thing in about our family. And we talk about the issues and try to mitigate any potential causes of any mental disturbances in the family. We live a very happy life. We enjoy our life. And we are very thankful that what we have in our life and we never regret or feel deprived of what we do not have. I try to encourage my kids to always cherish what God has provided us and be thankful to Him, to focus on what we already enjoy in our lives and try to stay positive and optimistic. Life can be lived to fullest with hope and faith. So those are
Mm,
some of the things that we use in our home, try to stay more mentally health as a family together.
yeah. And again, Shafiq, thank you.
Mhm.
With hope, you said, in
Yes.
faith.
Yeah.
And um, another thing that struck me is that, and I think it's really important to bring this up again, that mental health should never be a taboo.
Exactly.
That one's health and well-being and our ability to demonstrate to our children and our grandchildren the importance of mental health and how we walk out things like, hey, if I need help or if I need to talk to someone,
Mhm.
it's okay. And
Yes.
so thank you for you know, acknowledging that it should not be a taboo subject talked about within families or not talked about in families, but it also it lets us fathers know, that those fathers that are listening to us today, to rethink that position, that they don't need to walk that journey by themselves. So I thank you,
You're welcome.
Shafiq, for that. So the next, it brings us to the cousin, right? Many would say the cousin of mental and spiritual health
Mhm.
is our emotional health. And, as fathers, as men, that might be an area that might pose some difficulty. Could you enlighten us on you as a father and how you walk that course in your life as well, please?
Yes, of course. As a human, we have emotion expressed in in different ways. Humans are emotional beings, and if emotions are suppressed and are unfairly judged, it is important for a family to take care after each other emotional feelings and sentiments, and how you can manage your emotions. So mutual respect, regard, and understanding each other's emotions play an important role in the emotional health. In the family, we keep good, friendly, and respectful relationships. So those are very helpful tools for us. We never undermine or mock anyone's emotion. All have a safe space to express their feelings and emotions. As a parent, my wife and I recognize our children's responsibilities. We value their opinions and cherish their differences, and no one in the family is put down. So those are some of the tools and skills that we use at home, and in order to take care of each other emotions, to not hurt each other's feelings.
Yeah, thank you so much.
Yeah.
Shafiq, very profound. It's everybody has a voice, right?
Yes.
Everybody can make a contribution, and no voice should be quelled. And so, thank you for that. Moving forward, let's talk about our physical health. And I know I struggle with that, and many fathers may struggle with that. Um, could you talk to me about some behaviors or um, health behaviors that might that you model to your own children?
I try to encourage my children to stay active and have healthy lifestyle, and I encourage them to be part of any sports they would like, to have a very healthy eating habits, healthy sleeping habits, which is very important, and also taking part in the community welfare. Like I encourage my children to do just some volunteer work in the community that help them, and other activities that very important for their physical, mental, and spiritual health. And I can give you the example that I on weekends I do my best to take some time and take my children to the park, and I play with them tennis, volleyball, and soccer in order to help them to be physically fit. And when they see other children playing in the park, they get more encouragement, and they can get more motivation to work on their physical fitness. And it's very important to teach our children to be responsible and contributing citizen, staying away from harmful substances that damage our body, and any violent speeding while they are driving, or
Hmm.
any other negative behaviors, and to remain law-abiding, productive member of the society.
Yeah, and Shafiq, again, marvelous word here. So one of the things that I marveled at as I grew to know you, that very much how you model your life, particularly where it comes to doing outreach and supporting our communities. You're also, and that's health, right? You're
Yes.
also pouring that into your children. And I had a wonderful opportunity to see through pictures your own son
Yes.
modeling after his dad. And I just got to tell you that that was phenomenal to see. And that was generational health in action. And I just want to acknowledge that the byproduct or the benefit or the blessing of our work, it gets, and we have an opportunity sometimes to see that exhibited through our children. So I did want to mention that as well. Um, as we move forward in this last area, like what are the takeaways for our fathers that are watching us today or may want to connect with us in the future? Um, can in sort of the analogy of the toolbox, like are there some tools that you can give our fathers to put in their health toolbox?
So I can say that in order to raise your children healthy, as you mentioned about those four pillar of health: physical, mental, and spiritual and emotional health. So we have to consider all those pillars while we are raising our children. And also we need to teach our children that how to be having strong faith in worshiping, and also we have to teach them how to respect, abiding the law, staying physically active, and being part of any sport, as I mentioned. And I also tell to our fellow dads to teach our children how to learn to be positive, to have positivity in their life, to be optimism, and never losing hope. Life is full of challenges, so we will teach our children to not lose your hope. Not only children, but also parents, for the parents as well. Not hope, losing your hope, and there's always a light there. And also we teach our children humility, not being arrogant, and also focusing on achieving goals in the life, not giving up on noble endeavors. And also I teach my children to know how to take care of their parents when they get older or they become sick. So those are some of the tools that I would like to share with the fellow dads.
Thank you,
Yeah.
Shafiq. As we come to a close, a couple of things I want to share, if I may. I know that we have fathers that run the kind of the stratosphere of that may be actively engaged in homes with their children, but there are in our community a sector of fathers that may not be in their home, but that doesn't mean they still can't apply these same tools, that they can't be engaged more effectively in their children's lives. And I just want to also take a moment to speak to those fathers as well, that every father, no matter what your situation, you have a real opportunity to be intentionally engaged in those four pillars of health that we talked about previously. The other thing I will tell you is that there's great value in considering the legacy that we're going to leave to those that follow us, and we should all, as you mentioned, Shafiq, we need to look to and aim to leave behind, with a thought in mind when we depart this earth, how our work right now is setting the course for our generations. Um, and some thought about, you know, that inheritance that we want our children to receive from us. What can we do to enhance that inheritance for them? So, fathers, please remember, as we come to a close today, all fathers that are out there, whether you are in the home or working as a father outside the home, or if you're engaged in or maybe you need to be more engaged in your children's lives. I just want to be an encourager to you today. And I know my dear friend Shafiq will come alongside me in this, that every father has an opportunity and a role to play towards building health in your children's lives. From a generational perspective. So I thank you, Shafiq, and I
You're
thank you
welcome.
all for listening in, and have a wonderful day.
Thank you, Mr. Mango. Y'all have a good day. Thanks.
Thank you. Thank you.
Welcome.